Causes and treatment of hemorrhoids, piles. Causes of hemorrhoids. Hemorrhoids, also known as piles, are swollen veins in the rectum and anus that cause discomfort, itching, and bleeding. They can be internal, inside the rectum, or external, under the skin around the anus. Hemorrhoids develop due to increased pressure on the veins in the lower rectum. The common causes of hemorrhoids include 1. Chronic constipation or straining during bowel movements. Pushing too hard while passing stool puts excessive pressure on rectal veins. 2. Prolonged sitting, especially on the toilet. Sitting for too long can cause blood to pool in the anal area. 3. Low-fiber diet. A diet lacking fiber leads to hard stools, making bowel movements more difficult. 4. Pregnancy. The growing uterus increases pressure on the pelvic veins, leading to hemorrhoids. 5. Obesity. Excess weight puts additional strain on the lower body, including the rectal veins. 6. Aging. As people age, the tissues supporting the veins in the rectum and anus weaken. 7. Heavy lifting. Regularly lifting heavy objects can strain the rectal veins. Symptoms of hemorrhoids. The symptoms depend on whether the hemorrhoids are internal or external. 1. Internal hemorrhoids, inside the rectum. Painless rectal bleeding, often seen as bright red blood in stool or toilet paper. A feeling of fullness or discomfort in the rectum. Prolapsed hemorrhoids, when internal hemorrhoids push outside the anus, may cause pain and irritation. 2. External hemorrhoids, under the skin around the anus, itching, swelling, and irritation around the anus. Pain and discomfort, especially while sitting. A lump or swelling near the anus. If a blood clot forms in an external hemorrhoid, thrombosed hemorrhoid, it can cause severe pain and a hard lump. How to treat hemorrhoids. Most mild cases of hemorrhoids can be treated at home, but severe cases may require medical procedures. Here are some ways to relieve symptoms and promote healing. 1. Home remedies. 1. Increase fiber intake. Eating high-fiber foods, fruits, vegetables, whole grains, and legumes, softens stool and prevents constipation. 2. Stay hydrated. Drinking at least 8 glasses of water per day helps ease bowel movements. 3. Take warm sitz baths. Soaking the anal area in warm water for 10 to 15 minutes several times a day reduces swelling and discomfort. 4. Use over-the-counter ointments. Hemorrhoid creams containing hydrocortisone or witch hazel can reduce itching and swelling. 5. Apply cold compresses. Placing an ice pack wrapped in a cloth on the affected area for 10 minutes can reduce inflammation. 6. Avoid straining. Do not push too hard when passing stool to prevent worsening hemorrhoids. 7. Keep the anal area clean. Gently clean the area with unscented wipes or warm water. Avoid harsh soaps. 2. Medical treatments. If home remedies do not provide relief, a doctor may recommend. 1. Medications. Stronger prescription creams or suppositories to reduce swelling and pain. 2. Minimally invasive procedures for persistent hemorrhoids. Rubber band ligation. A rubber band is placed around the hemorrhoid to cut off blood supply, causing it to shrink. Sclerotherapy. A chemical solution is injected into the hemorrhoid to shrink it. Coagulation therapy uses heat, laser, or infrared light to harden and shrink hemorrhoids. 3. Hemorrhoidectomy. In severe cases, surgical removal of hemorrhoids may be necessary. Prevention of hemorrhoids. To prevent hemorrhoids from developing or recurring, follow these healthy habits. 1. Eat a high-fiber diet. Aim for at least 25 to 30 grams of fiber per day to prevent constipation. 2. Drink plenty of water, helps soften stool and prevent straining. 3. Exercise regularly. Physical activity improves digestion and reduces pressure on rectal veins. 4. Avoid sitting for too long. Take breaks and move around every 30 to 60 minutes if you sit for extended periods. 5. Go to the bathroom when needed. Do not delay bowel movements, as holding it in can lead to hard stools. 6. Practice proper hygiene. Keep the anal area clean and dry to prevent irritation. When to see a doctor. Seek medical attention if 1. Rectal bleeding becomes severe or persistent. 2. Hemorrhoid symptoms worsen despite home treatment. 3. There is extreme pain, swelling, or a large lump near the anus. 4. You experience changes in bowel habits, such as persistent diarrhea or constipation. By following these treatment options and preventive measures, hemorrhoids can be effectively managed and prevented.